All right. Good afternoon, everyone joining us from Los Angeles, or good evening, depending on where you're joining us from. Welcome to our COVID-19 Community Summit. Is the pandemic over? What you need to know about COVID-19, the variants, and vaccines. I just want to thank everyone who's taken so much time out of their schedule to be here with us today. We had 188 plus people registered. Fantastic, fantastic. So I'm very excited to just have this conversation with everyone. We have an expert team, an expert panel. At first, I was going to say we have an all-female, all-women, but now we have an all-female women's empowerment panel plus we do have one of our very own Dr. Jessie Clark, who's also joining us. So the Fab 4 plus 1. So we'll say it's the Fab 5. So again, thank you again so much for joining us. Again, this is the pandemic over. So I will be kind of moderating this event directly, but if you all have any questions, if you all have any concerns, if you have things that you want to ask our panelists, just go ahead and drop those notes into the chat, and we will be responding to them accordingly, either going throughout the conversation or bringing some of those discussion points and questions up at the end of the dialogue. So just put your thoughts in, and we're actively monitoring the chat, and we will be announcing questions, comments, concerns, complaints, etc., all into that chat. So at this time, I would like to introduce a little bit more. So if we could go to our next slide, please. And I just want to introduce a little bit more of our team. We're at the University of California, Los Angeles, behavioral and addiction medicine. And this is a very multidisciplinary, interdisciplinary team of scholars and folks here at UCLA who are doing work that is advancing the prevention and treatment of chronic illnesses. We have conducted clinical trials and behavioral studies, and there is a focus on communities with health disparities. So we like to call ourselves CBAM for short. And CBAM has led a COVID-19 Moderna vaccine clinical trial site at Vine Street Clinic. So we are delighted to have our very own Dr. Jessie Clark here to discuss some of those experiences as this conversation moves forward. So he's directly involved as one of the co-principal investigators of that. Next slide, please. Our project today is supported by the California Community Foundation, and the aims of our project are to facilitate community, public, private, and governmental partnerships to reduce COVID-19 vaccine inequity, educate communities of color in South LA about COVID-19 vaccines through virtual town halls such as this, and to navigate communities of color in South Los Angeles on how to access COVID-19 vaccines. And just to alert for those who may not be able to join us live, we are going to be sharing this recording. So we welcome all those who are joining live, but also those who are going to be watching and are watching on the replay. So we do thank all of you for being here with us. Next slide, please. If you're interested in learning more about our work or communicating with our team, we have our contact information. Again, I'm Dr. Delara Uskup. I'm the co-principal investigator of this project. We have Dr. Stephen Shoptaw. He's the fearless leader of CHIPS, the Center for HIV Identification Behavior, CHIPS, the Center for HIV Identification Prevention Treatment Services, and the fearless leader of CBAM, the UCLA Center for Behavioral and Addiction Medicine. He's also the co-principal investigator of this project, and you see his email listed. And then we have Dami, who is just everything. She's made this whole project happen. You may have gotten emails from her, but you also have her contact information. She's our project coordinator. So we are really grateful for Dami and Enrique's support, but you have all of our contact information should you want to be in touch with us later. Next slide, please. All right, so again, the overview, the goal of this summit is to share the latest information about COVID-19, the variants, and the available vaccines for adult children in Los Angeles County, with a specific emphasis on South Los Angeles. And again, we want to ask this question: is the pandemic over? I'm seeing folks up and out. I'm seeing folks without masks, but I'm seeing those numbers of hospitalizations, those rates of hospitalizations, numbers of deaths, I'm seeing that going back up. So as folks are going back out, I'm seeing those numbers going back up. So that's what we're here to talk about and engage around. And we have this super expert panel that we have put together from the Los Angeles Metropolitan Churches. We have the executive director, Ms. Cheryl Branch. Let's give a round of applause for Ms. Branch. We have Dr. Francis Payne, a pediatrician at Cedars-Sinai Medical. Round of applause. We have Dr. Eloisa Gonzalez, the director of cardiovascular and school health at the Los Angeles County Department of Public Health. So we're so delighted to have here from the Department of Public Health. Welcome, Dr. Gonzalez. We also have Dr. Nonye Okonkwo, the Deputy Clinical Operations of the COVID-19 Vaccine Program at Kedron Community Health Center. And I have served with Dr. O before, and as she is phenomenal as she's running vaccine trials at Kedron. She is a one-woman superstar. She is amazing. And also, not last but not least, we have Dr. Jesse Clark, who I referenced, is also coming from the UCLA team, and he has been an integral effort of the Moderna clinical trial site that was held at the Vine Street Clinic. So we welcome Dr. Jesse Clark to the stage and to the call. Thank you. Let's give him that round of applause. So again, just a reminder, you can put questions into the chat. Before we dive into if you folks have questions now, feel free to put those into the chat. You can also send questions anonymously using the link in the chat. And, this is a community space, so we do want to be respectful of everyone. We may disagree, we may agree, hopefully we can have some consensus, but we do want to remember to be respectful, to treat others how we want to be treated. So let's be mindful of that. And also, we want to remind all attendees that there will be a raffle, for all those who are registered. So a number will be selected that corresponds to your last name and initial of your first name. Only those who are registered and present will be able to win. So if your name is called at the end, respond in that chat if you are present. So we will turn it over to Dami later to facilitate that process. And this is also, I believe, being live streamed on YouTube. So we welcome our guests that are watching on the live stream, both here on Zoom, but also those who are watching from YouTube. And again, those who are watching the replay. So now I just want to go right on in. I just want to jump right on into the conversation. And if we can go to our next slide. I want to know what's going on. What's going on? Is the pandemic over? I want to open it up to that question of, is the pandemic over? Especially here in Los Angeles County. Should we take our masks off? Should we be, not social distancing in rooms where we may not know the vaccination status of others, unmasked? What's going on? So I would first like to open it up to Dr. Gonzalez at the Department of Public Health to begin to dive into this question of, is the pandemic over?
Thank you. Unfortunately, no, the pandemic is not over. We are actually in the if we were still back in that tiered system, if you all remember, at one point we were like in this colored tier system where purple was like the highest risk of getting infected because community spread was so high. We're no longer in that system, has been retired, but if we were still in that system right now, the level of community spread would put us squarely in that purple most risky category. So it's definitely far from over. There is also last week, we issued a health officer order requiring everyone, so this is different from the state, important to know. The state of California isn't requiring everyone to wear masks indoors, regardless of vaccination status, but because of our local LA County community spread, we are requiring that if you are in any indoor setting in Los Angeles County, whether you have been vaccinated or not, you're required to wear a mask indoors.
And I want to open it up to our other panelists to just join in this conversation of, is the pandemic over, and what do you all see from your purview happening in Los Angeles County? Dr. Pang, what's going on as it relates to peds, as it relates to children? You know, we're getting ready, and I know we're going to talk a little bit about going back to school, but what are you seeing from your kind of vantage point?
Yeah, I mean, on the ground, so to speak, we did see a really dramatic reduction in the number of people that were calling us, reporting that their families were having contact with COVID back in sort of March, April, May, June, even the beginning. But now we are starting to see a lot more positive cases just from an anecdotal standpoint, and all of our patients that are calling in, we're getting more positive tests on people that we're testing in the office, but we're having a lot of people calling us to say that they've had contact with somebody who's been positive. Sorry for that. Fire engine there. So we are definitely seeing that more, and we're starting to count down, you know, the 6 weeks that it takes for you, 5 weeks that it takes for you to get your first dose of Pfizer, and then 3 weeks to wait to get the second dose, and then 2 more weeks to be fully protected. If we count back from the first day of school, that's right now. So we are starting to kind of feel that it's going to be really important for our pre-teenagers going back to middle school and high school to really get that done. So that's what we're feeling in our office with our patients.
Dr. O, what's happening at Kedron? What are you saying as far as this question of, is the pandemic over, and what's going on in LA County?
I think one of the most interesting things that we have going on here at Kedron is we're vaccinating, but we're also doing COVID testing. The increases in COVID testing are absolutely remarkable, to the point where we've actually extended our hours to accommodate everyone coming for COVID testing. And we're not just doing PCR, we're even offering rapid tests for people so that they can have all access to their information. And what we've seen in the last 3 days since Monday is we went from 16% positivity rate on Monday at our clinic in Watts specifically, which I can talk about because I have access to that data, 16% positive out of 109 people. Tuesday, 72 people, we went to 15%. On Wednesday, out of 50 people, 20% were positive. So when we're talking about, do you want to go to a party or do you want to hang out? Would you go to an event if there was 50 people, if you knew there was a chance that you would get anywhere between 15 to 20% positivity? And most people would hesitate, but the hesitation is not necessarily getting people to consider getting vaccinated. We're still having trouble getting people from the testing line to the vaccination line. And that's something that we're all working together for. And that's why we're having this call today.
Okay, seems like Dr. O's scoop is
I'm back.
You're back.
I'm like, refresh, Zoom. But I thank you for this expert panel. Ms. Branch was going to jump on in, but I want to also invite Ms. Branch, and I also want to invite Dr. Clark. Do you all want to, you know, kind of share what you're seeing just on the community and clinic level?
I can go. So I represent the community. We have been the community engagement partner throughout this process since last year. And I think what I'm seeing is a strengthening of that understanding, how important it is for the medical professionals, the public institutions, between Department of Public Health, Department of Health Services, Department of Mental Health, this three-legged stool. I have seen an increase and an improvement in how we all work together. When we came to them last year, our message was saving lives through effective community partnerships, through effective community engagement, because we knew in the places that we live, work, and worship, there were already existing preconditions. There were already barriers access barriers, quality of care, shortage of personnel, and just the pecking order because of where we are situated geographically, economically, population-wise in South LA. So having, with that being our baseline, our best hope was to create an infrastructure to bring together smaller organizations with budgets less than $500,000, maybe 8 to 10 staff at most, who could pivot. And our department leaders depended on us for that, because what hasn't changed is there was this discrepancy between demand and time. And our departments, our agencies that are charged with this responsibility could not pivot fast enough to catch up, meet the demand, and check all the boxes. So I think that what has happened for us and what's deep in our commitment, deep in my role, has been the urgency to pay attention to. We're definitely not there yet. We should not be taking a victory lap. For sure, for Black populations, when you talk about population health, the Black community in LA County is taking a significant hit, can't be missed. And I appreciate them for allowing us to say that and to hold the line that we need to keep that as a priority. Where I'm humbled, I'll tell you where I'm humbled, Dr. Uscoop. Sometimes when I look around the table, I say, oh my God, I've been working with these people for 15, 20 years. And what that means to me now in the past year is we need to expand leadership. We're doing a terrible job. I just have to admit it. All my peers may not agree with me of reaching and engaging with our young population and our young adult population. That's individuals between the ages of 13 and 30 years old. We're not doing a good job of reaching them. And that is a population that we're all very concerned about. There's not a lot of data that helps us to shape messaging for them. So what we've been talking to the county department heads is we know they're sharing more detailed information within the various need to know departments, but we need to know too. We're not getting the race data. We're not getting the age data. We're not getting the ethnicity data. We need some of that data, like some of the other department heads, so we can create better messaging, and activate these new community influencers. That's what we've had to define these young people as, community influencers. If you have more than 500 followers on your social media, then we're considering you a community influencer in LA Metro churches, and we're training and equipping them to help us do this kind of policy media messaging. And I'm really excited about where that's going to go now and in the future to try to help us bring some of these numbers down. And then these kind of forums, we need more of them. Some of our trusted health professionals in the Black community in LA County, they're on the Zoom and other weekly, but it's not enough. We have to get connected to these community health influencers now, these new ambassadors that we're going to have to bring them into our business, teach them our speak, and we're going to have to be like Jehovah's Witnesses. We're going to have to canvas. We're going to have to go door to door. It's going to be one-to-one, and it's going to be until it's not needed anymore. Yeah.
Dr. Clark.
Yeah, thank you, Dr. Uscoop.
Dr. Peng,
Thanks for letting me join the Fab Four here. I would add my perspective as a physician. I'm an infectious disease specialist, and I work on the inpatient COVID service at UCLA. We'll be there this weekend. The epidemic is absolutely not over, but I think it just highlights even more the importance of vaccination, because there are more and more cases recently of people getting sick and hospitalized, but basically none of these people have been vaccinated. If you have been vaccinated, you might have asymptomatic infection, you might get a mild infection, you might even feel sick, but you probably won't be hospitalized, and the chances of hospitalization or death are negligible compared to people who have not been vaccinated. And I would just also highlight for the people listening, all these people who are in the hospital now, all the people who are potentially dying, they made it this far, and they probably thought the epidemic was over and they were fine. Guess what? It's not. And they're finding out the hard way that, the virus is still circulating and people are still vulnerable, especially if you're not vaccinated. So.
And I know you all have touched on some of this, but I do want to just keep moving our conversation. One, I just want to read Damone Thomas has a comment in the chat. And don't forget, our chat is still active and open. And Dami can circulate once again in the chat an anonymous questions submission. If you want to submit your question anonymously, we have that mechanism as well. I just read about a Black couple in the South refused the vaccine using Tuskegee as a reason. They just died from COVID-19. We still have work to do. So what are we seeing in LA County? What are the populations that are hardest hit, and what communities as the data indicates are most hospitalized with COVID-19 in LA specifically? So I just want to open this up to our panel.
Maybe I can share a little bit first and let my colleagues take it as well. But we're really seeing the lowest levels of vaccination among groups where we're seeing the highest rates of transmission, hospitalizations, and now deaths. We continue to have very large gaps in vaccination between age groups and racial and ethnic subgroups, as has been mentioned by my colleagues. Gaps still exist among younger teens and younger adults, among both the 12 to 15 and the 16 to 17 year age groups. About 1/3 to 1/2 as many Black and Latinx teens, and about 2/3 to 3/4 as many white and American Indian or Alaska Native teens are getting vaccinated as much as their Asian counterparts, or compared to their Asian counterparts. We're also really concerned about the low levels of vaccination among our Black and Latinx residents that are just a little bit older than that as transmission continues to rise. As has also been mentioned, the data currently shows really significant gaps among adults 18 to 29 years old, with 29% of Black adults in this category and 44% of Latinx adults having been vaccinated. That's compared with 60% of their white and 77% of their Asian counterparts. So between 1/2 to 2/3 fewer. This disproportionality also persists among our 30 to 49-year-olds. In that group, vaccination rates among Black adults are 1/3 to nearly 1/2 lower than the rates among their Asian and white counterparts. So we really do urge full compliance with indoor masking, the indoor masking requirement that I mentioned earlier, so that we can really get back to reducing the community transmission rates. And of course, really highly encourage everyone to get vaccinated if they're eligible. Really slowing the spread right now not only protects the vulnerable unvaccinated residents, because we are right now, this is a pandemic primarily of the unvaccinated, as Dr. Clark pointed out. Slowing the spread also will protect and reduce the chances of more mutations that could result potentially in even more infectious variants than the Delta variant that we're seeing now, variants that could potentially evade our vaccine protection.
I think we should go back to some of the daily briefings and maybe take it to the next level, where our health officers and our top executive leaders could begin to select throughout the days and weeks different individuals from the community and populations to come forth and be those peer-to-peer messengers to help encourage the unvaccinated to get vaccinated. Some of the young people and families that have lost parents and loved ones, we may have to help the officials to identify those families that are willing to speak and let them get before the general public. And we continue that technique, even though I know some of our officials have been criticized, but let them know that we support that. We need to be out there every day speaking to the general public on all possible communication to keep these messages and information in their face. We are weary. When I talk to I'm just the everyday people. I don't have the statistics that my colleagues have here, but I can tell you about the everyday people. They're emotionally, mentally, they're tired. They're anxious, and they're operating literally on fumes. And then we also have our community workers that are on the front lines. Who do you think are in these high hotspot places. And so our community, there's only so many of them. These are the things we can measure, and they can only do so much. So I just think one solution, because we want to be solution oriented, it's not the end of the world, the sky is not falling. I think getting back to having Dr. Ferrer and Dr. Muntu and others, Dr. Veal and others, Dr. Gonzalez and Dr. Pang, Dr. O, we need these folks. These are the trusted people on the front lines coming out, and they need to expand that and let them speak to us every day, talking to us about the vaccines, like a 10-minute chat, quick chat, a little almost like a video blog, more than just let me give you the statistics. That part you can put on the website. But what we need are these stories and this qualitative conversation that these professionals you have here, Delara, can bring, representing all the types of people that are here in Los Angeles. I vote for that.
I want to second that. I want to turn to Dr. Pang.
Sorry, I 100% agree with what Ms. Branch is saying. I mean, even data from maybe like 5-6 years ago, which we know this stuff changes year to year so quickly, shows that most high schoolers, most kids like in that 12 to 20 age group, they get some of their health information, this is even before COVID, from their parents, limited amount from their friends, but more than 50 to 60% get all their health information and their questions answered on YouTube. And they don't go to the most reputable websites. They just go to the ones that people send them links to, or that they Google some random thing. And this is where they get all their information about STIs, COVID, everything. So, you know, we do really need to get into there. I think that this idea of looking at our patients, a lot of parents are not encouraging their kids to get vaccinated or take them to get vaccinated because they are concerned that, you know, it's not that dangerous if you're a kid. Not that many kids get really sick with COVID or die with COVID. I balance the pluses and minuses and I decide, like, I don't think it's that important. The issue is you have this pie, right? And in the very beginning, a small part of the pie was the kids getting sick. Now, because the whole pie is a bit smaller, because all these people have gotten vaccinated, a much bigger part of the pie are the children. And I think that's where the message gets a little lost. And, you know, if you're in the pie that's unvaccinated, you cannot get out of this pie until you get a shot. And if you're in the pie, you're 100% in the pie. It doesn't matter that overall our cases are going down, because that doesn't count for you if you haven't gotten the vaccine. So I think, you know, there's so many numbers that it can be easily overwhelming. And you can really focus on some scary stories and scary side effects, and then kind of lose sight of the whole big picture. So I think that's where, you know, the messaging specifically for our young people is so important. You know, that you had mentioned, Dr. Clark, the 18 to 24-year-old group, or 18 to 29. I mean, that's always been a super high transmission age group, and yet they are not necessarily, you know, jumping on board with the vaccinations. And they're in the same group that is, you know, a lot of essential workers are in that same age group too. So it's kind of like, you know, coming together of some risky risk factors for that age group for sure.
I want to bring out, and I do see folks raising their hands. Feel free to jump into our chat and put in your questions or comments, or use our anonymous link on Qualtrics that Dami is in the chat if you would like to submit your question or comment anonymously. But I do want to lift up some of these questions and comments from the chat. And one says, from Andrea, this have been hearing from community members they are counting on their, quote, proven immunity, unquote, from COVID. And I want to link that comment to Lydia B, and she's asking Dr. Jessie Clark, folks that have had COVID-19, should they get vaccinated? Most folks are telling me, no, I don't need it because I've had it. So Dr. Clark, how do we need to respond when folks are talking about their proven immunity, or that they've had COVID, they don't need the vaccine? Can you kind of help us do a little immunology, help us understand our other providers after Dr. Clark, if you all want to jump in, please feel free to.
Yeah, everyone should get vaccinated. Even if you have natural immunity, even if you previously had COVID infection, you should still get vaccinated. Natural immunity is not as protective as the immunity that you get from vaccination. So I was just looking through my slides. So Novavax, when they were doing their clinical trial, they had one site in South Africa, and this was when one of these new variants started circulating. And so they looked at immunity and protection among these people, and they found that people who were vaccinated had similar levels of protection of 80 to 90%, like they saw in other studies. But people who had a natural history of infection, people who had COVID previously, were not protected against these new strains. So even if you've had COVID before, it's still critically important that you go out and get vaccinated, preferably with one of the mRNA vaccines, because it's just much better protection than you will get even from having had COVID before.
Our other providers?
And I think it's important to note that that's not necessarily the case with other vaccines. So for instance, like if you get the chickenpox, the actual chickenpox disease, your protection is excellent compared to the vaccine, but that's clearly not the case with COVID. So I think people who might have had that belief from, based on other vaccines need to understand this is not the same case. Getting the vaccine is still really important. And practically in our practice, we see that all the time. People are like, I tested positive back in the early days of COVID. I thought I was okay, and then I got COVID again in the summer or whatever. Yeah.
Dr. Earl, would you like to jump in?
I think Dr. Clark brought up a really good point about reminding people about the efficacy of the vaccines that we have. We have 3 safe and effective vaccines. And what we've seen in Watts, specifically with our immigrant community, is that there's a high percentage of people opting for the Johnson & Johnson vaccine, despite the kind of the media and the news reports around, some of the issues that we had earlier in May and June. But what we know based on the data and the clinical trials is that this vaccine is safe and it prevents you from getting severe hospitalization or illness or death from the COVID vaccine. And the health promotorials, specifically in Watts, we made sure to go out of our way to focus on Johnson & Johnson because we had so many people who wanted to go home to visit their families, right? And continuing the economic growth and people kind of getting back to life, we were able to convince them with data and with the community that Johnson & Johnson works. And it's one dose and it allows you to get back to where you're going. And one ambassador from a community literally told everyone else, and we're getting this droves of people who are interested in getting Johnson & Johnson. So just to remind people, we do have Pfizer, we do have Moderna, but Johnson, if you're concerned about getting sick, you're concerned about coming back in 21 to 28 days, we have options.
Thank you for that. I want to turn.
Sorry, may I add something real quick?
Absolutely.
Wanted to mention on top of what Drs. Peng and Clark mentioned already regarding, if you've already been infected with the actual virus, should you still get vaccinated? And so I completely agree, a resounding yes. Unvaccinated people have more than 5 times the risk of becoming infected than a vaccinated person. So in June, for example, fully vaccinated people represented 20% of all cases diagnosed in LA County, while unvaccinated or partially vaccinated people accounted for 80% of the cases. So really, it's important to get that vaccine, whether you've had the infection and recuperated or not.
Thank you for that. I want to turn to this question about wearing a mask and, should we wear a mask and why, especially if you have been vaccinated? And I also want to, as we're asking that question, lift up a question and comment from the audience from Obi, who says, what can the LA medical community do to address the recent actions of people like Sheriff Alex Villanova, who, bearing enormous influence, publicly undermine the efforts being discussed here that we all agree are necessary? And I do also want to add, I did kind of see that clip, that that headline, but then also I after doing a little bit more investigation, and I was having some community conversations with some folks about this actually recently this week. And I also do think that that was kind of sensationalized in the sense of it was missing some of the context that he also included. And he was saying that, violent crime in LA has increased. And because of certain cuts that have been made, police, he wants to focus attention on, on what's happening with crime, and he does not have the police power and the resource. And I'm not saying it's right or wrong. I just want to provide this context from what I understand. But he does not have the power to be able to necessarily enforce. Again, I'm not condoning his comments or anything like that, but I did just want to add that, I did hear also that nuance. But that message is coming out. Folks are hearing to not wear a mask, or that they're hearing that kind of de-emphasizing of the mask. So should folks be wearing a mask if they're vaccinated, or if they're not? Tell us, why people need to wear that mask. What's the science behind that? And then two, when influential folks either say it intentionally or unintentionally, or there's a soundbite or this or that, where they're having a message that's saying to not wear masks, what can we do? What can we say as community members, as providers, to counteract that, or what into? So I want to kind of pose both of those questions and comments together.
Maybe I can start. So at this time here in LA County, I mentioned earlier that last week we actually published a new health officer order requiring masking indoors in public settings, and that's regardless of vaccination status. We have been getting some questions about applying the guidance in that order in special situations. So I'm just going to take a minute to answer some of our frequently asked questions regarding enforcement and special instances, if you will. So individuals under 2 years old are not required to wear a mask at any time. It's considered potentially a safety hazard, and I'm sure Dr. Pang will agree. And then in addition, if a medical provider has told you that for some medical reason you are not recommended to wear a mask, then you would be exempt, in which case we would probably encourage you to just not be out and about in public. And so other than those two, which would be exceptions, everyone else, vaccinated or not, should wear a mask. Now, in crowded areas, particular that are partially enclosed by walls but not fully, respiratory viruses in those kind of situations are transmitted more the way that they are in indoor settings than they are in wide open outdoor spaces. So for that reason, masking requirements that we have currently in place apply in partially walled areas of outdoor venues like concourses and concession stands, for example. At larger gatherings in event spaces such as hotels or event halls, masks are required if the events are indoors at those venues. Similarly, masking is required indoors at houses of worship. And while we don't require masking at private gatherings in homes where unvaccinated or immunocompromised people are present, it's still like universal masking in those scenarios is still the best way to protect everyone. So while vaccinated people can be reassured about the protection that the vaccine gives them from severe COVID disease, we can't yet reassure you that given the proliferation of the Delta variant, that the vaccine is going to protect you from infecting another person. So that's what this masking up right now is really about. It's adding an extra layer of protection, really to prevent the heartache that comes with transmitting the virus to others. Slowing the spread, like I said, not only protects those who are vulnerable because they're unvaccinated, but it also reduces the chances of more mutations that can result in more infectious variants. Again, if that happens, there's the potential that those new variants could evade our current vaccine protection.
And I think we have to remember that, of course, kids under 12 aren't even eligible to get the vaccine yet. And we're trying to encourage them all to, requiring them all to wear masks when they go back to school. So, it's all a matter of kind of the numbers. So if we can get the majority of everyone to be following this, then it's going to help protect the kids as well and set a good example. It's going to be hard for them to be like overnight, okay, tomorrow it's time for school. You got to be wearing the mask all the time. So if parents are wearing the mask, people in the stores and shops are wearing masks. It sets a good example. The grocery store, it's one of the things that's really not that hard to do for the amount of benefit that we're getting. And I think, kids, in my experience, kids most of the time, if they've been wearing them in their preschools and daycares, they adjust pretty quickly. They're pretty flexible and they're willing to wear them. And we really haven't seen like any kind of health adverse effects at all from wearing the mask. And they've done a pretty good job, kids, with them. Mm-hmm.
All right, thank you. I'm going to jump in while Dr. Uskov is connecting back. I believe she might have some issues with her internet. Thank you. So I'm jumping in, Julie. I'm going to go ahead and just go through some of the questions in the chat and Qualtrics. And forgive me if I'm not asking this in order, but I think we can go through some of this before she gets back. All right, so do you have any insight for the immunocompromised community and booster shots? And how do we protect ourselves and still send our kids to school? And also in that line, somebody also asked a question, and I think this will go to Dr. Gonzalez in regards to LA County's plan for protecting kids as they open, and if there will be any reason to close schools again.
Should I start with the schools question? About
you can start with this question and then somebody can take the other one.
Okay. Yeah, so we've actually never ordered schools to like stop, right? So to close. So we have and legally I'm not exactly sure that we could do that. I mean, there's a certain population of youth with particularly youth with special needs that do require in-person services. So for that reason, I don't think schools will ever be like completely closed. We can recommend that school districts use the data that we have published and follow recommendations that they maybe not have students on campus if those students do not absolutely require being on campus. It's a balance. We want children. It's very important for children, well, for all of us, but for children in particular, to be able to socialize and to be able to learn all of these social, emotional sort of skills that come with interacting in person with other people their age. So if we, don't have children in classrooms, it's already been a year plus, that's really going to have potentially long-term impacts that are maybe even some unanticipated. We're really trying to avoid that. So we really would love to be able to have everyone do everything that they can to be able to continually keep our children safe until which point, like Dr. Peng said, children under 12 are not eligible for any vaccine at this point. So we want to protect them. And the best way that we can protect them at this point as they go back to return to school, and so that we have a successful return to school for all children, is to make sure that we follow the masking measures, right? So everyone in the school settings, including adults, whether they're vaccinated or not, are required. This is state law, not just necessarily just LA County, across the state. In education settings, masking is a requirement for everyone. So that is put in place precisely because not all children are going to be able to be vaccinated because they don't qualify yet because of their age, or maybe they have a medical condition. So we want to be able to protect them. And so protecting the children through the masking while they're at school will also then protect their families when they come back home. Because if they didn't get infected at school because everyone was wearing a mask, then they're not likely or as likely to bring home an infection to their vulnerable family members who are vaccinated at home or immunocompromised.
Yeah, I think in school settings, because they're not really able to do social distancing, then they have to wear masks, right? And so far in the numbers that we've seen, school transmission within school is actually not as common as it was originally feared. We are seeing a lot more transmission after school kind of activities, sports and things where people are not wearing masks and everything, but transmission within school where teachers are making sure that the kids are wearing their masks, and that hasn't really been a big driver of infection in kids. So I think that's very encouraging. And I would absolutely agree. It's so important for kids to be back in school in person. We've just seen, countless kids, teenagers, young adults who've had so many mental health challenges and so many issues with anxiety and depression, not being able to have that really important social contact with their friends in person.
I do want to jump in. Dami, there was a question in the chat. Now, I do thank everyone for their continued patience in this virtual space where, you know, when things can, the internet disconnects. It's always when you're in the midst of a presentation such as this. So I do thank you all for your continued patience and for everyone still jumping in. Dami, there was a question in the chat that was asking about the air conditioning being down, it being hot. I don't have the exact text of the question because the text disappeared when I had to restart the computer. But if someone could read that question aloud, and if we can have one of the providers on our line, one of our MDs on the line, respond to that, I want to make sure that that question is uplifted.
I'm trying to find that question. Maybe
I have the question.
Okay, go ahead, Doctor.
It looks like it's a question from Vera Telichek. How important for ventilation at work? So if the HVAC is down and there's no AC, it's hot, 82 degrees, no duct cleaning done yet, and UV replacement done yet. Everyone's coming back to work. Is this a health and safety issue? If not, yes or no? And then what if not all people are vaccinated? This is the second part, I think, of the question.
I mean, I don't know. I don't know how to answer that one. I don't know what to say about that. I think each employer and the county health department is providing resources for the reopening process. I don't know if it's a disease or if it's unhealthy. Of course, dirty decks are not healthy. You know, I think that's just everyday common knowledge. Why an employer that if you as the employee knows, the responsible parties in the company know, and that will be the question, you know, what can they do? Is it a matter of resources? Is it a matter of labor? They need extra help to take that task on, or I don't know. I think that would be something that we could follow up with you on. We have resources for reopening, and we did create out of our community health workers, we actually have about 4 individuals that we've trained and orientated to go visit at least nonprofit organizations within our network to help them with that reopening, cleaning and moving things around and setting up the spatial distance and bringing in air control filters to read the air and help us to all understand these things. It's not a perfect science. So I think it's more going to be trying to encourage, motivate, make your leadership feel like this can be done and we can help with some of those resources in the community response system. That's all I can say.
I can add, workplaces in California are, the safety of workplaces is actually governed by OSHA, Occupational Health and Safety, I think, Administration. And so they have a website, and I think they on their website have a number where employees, if they're concerned about the safety or some aspect of their employment being unsafe, they can report or at least file a complaint. OSHA would then follow up with an investigation to make sure that the environment is safe from all aspects, including air conditioning. I would imagine. I don't work for OSHA.
And just from a provider really quickly, because I do want to, after the next provider speaks, get to the Delta variant and COVID-19 variants. And if Ms. Branch and Dr. Gonzalez, if you all have any relevant links, or Dami, Enrique, CBAM team, if we can get those links into the chat, that would be great. But for this, for Vera, what should she do in this environment? Should she be wearing a mask? What are the precautions she can take while these other complaints and you know, everything else is kind of going through that chain of command in that system? What can she do?
If I was her, I would stay home. I mean, you have to feel empowered at this time of course, with the balance of being accountable, responsible, not disruptive. I don't mean it in that way when I speak so definitively, but I think for community members, workers, if you're just an everyday people like me, it's about feeling empowered. And then there's a continuum of empowerment. So you can talk to your leadership and let them know how uncomfortable you feel. The magic words for any employer, because I'm a small employer, is I feel uncomfortable. As soon as you say that, someone's going to meet with you and try to come up with a solution for you. And so sometimes it's having the courage to speak out and say that. And if you need help, I think OSHA and other employment type councils, these types of group have already started emerging. So I'm going to put our information in the chat for you, Vera, and you definitely reach out to me, Cheryl Branch, and I will help connect you to the right people to help you get past some of this. But it's a very good question. I thank you for your bravery just to put it out there like that, because I feel the real place that you're coming from, and I thank you for that, and we'll get you some support. I'm going to put that in here now.
And just from a provider, if we can just get just a really quick response to Vera, because I do want to move to the Delta variant, so I am going to kind of accelerate our conversation moving in this last 35 minutes. Any provider, any of our providers want to provide that feedback if there are persons on this line who may not be in a position to be able to advocate for themselves, or again are waiting to get a complaint through. What can they do on the day-to-day in this type of work environment?
We can speak to that a little bit here at Kedron via operations. I think it's important you have to team up. I think if you have a concern, there's a likelihood that your teammates and your peers also have the same concern. And if you can relate it in the perspective of lost productivity, in the sense that we're not coming to work because we're concerned about our safety, there are definitely options that you can use. One would be possibly to change the location. At Kedron, we kind of moved from indoor to these partially walled venues that Dr. Gonzalez was talking about. We put up tents. We also got some temporary and ventilation system. Maybe we can't afford to change the entire HVAC, but you can afford a plug-in unit that the facility or the organization might be willing to sponsor, just so we can get air moving. There's some options that we have, and I posted a link in the chat as the Environmental Protection Agency and has some resources and frequently asked questions about HVAC and indoor air ventilation. So there's so many things we can do, and nothing is definitely not one of them. So again, speak up.
Thank you. All right, let's move to the COVID-19 variant. So I'm just going to rapid fire ask all of these questions, and then our team of experts, just jump in on one question, because I want to make sure we get as many questions as possible. So I do ask at this point, if someone has answered the question as accurately and wholly and concisely, let's try to move to another question. But some of the questions we've been getting are, how do viruses mutate? How many different COVID-19 variants out there? How dangerous is this Delta variant? How does the COVID-19 virus affect the body? So if you all can speak a little bit more about just 30 seconds, breaking it down to my grandmother on how a virus mutates. And then also, the nature of this Delta variant, we're hearing a lot about it. You all have talked a lot about it. How dangerous is it? And how many variants are there right now that you all know
of? I can speak to that sort of. So the virus mutates a lot. It's constantly mutating. A lot of mutations don't lead to anything. A lot of times when a virus mutates, it impairs what's called its viral fitness. So it makes a mutation that doesn't actually help it. It makes it less likely to survive, so the mutation just drifts away. Sometimes the mutations are successful and make it more infectious, like we're seeing with this Delta variant, or cause more serious disease, like you see with the Beta variant. So the most commonly circulating variant strains that I've heard about have been Delta, Beta, and Lambda. So Delta is the big concern here, just because it's so infectious. So it's more infectious than the original wild type strain, that it's causing a lot more infections. Beta causes more serious disease, but I think it's not as transmissible as Delta. So I think that's probably really what we are concerned about is the Delta strain. That's what's going to become the standard strain of COVID in the United States.
Dr. Payne?
I think there was a question about like, how does it affect the body? And I think initially we saw a lot of people with mainly lung problems ending up on ventilators. I think that's what the first wave of COVID was mostly seeing people getting really sick with their lungs. But it's clear now that the virus actually affects like all the different parts of your body, including a lot of your little blood vessels and things. And so in the pediatrics, there are a few more rare types of complications with COVID, but they have to do with those things. So, I mean, I don't think we don't have enough time to really speak on that, but there are some very serious complications, including this condition called MIS-C, MIS-C, that occurs in children. And so we just need to be kind of mindful of that as well.
Thank you so much. And I do want to turn it over to our next section, which is vaccination information for adults and children. And some of the questions that are populating are the long-term safety of the COVID-19 vaccines, the importance of the COVID-19 vaccines and vaccination for children and youth over 12. And, you know, some folks have heard things like, isn't COVID less common in kids? Is it less dangerous? Does that mean my child may not get COVID, may not need the vaccine? And then what about kids under 12? I know, Dr. Payne, you have some information for us about what's on the front with clinical trials for kids under 12, but can we provide some guidance about vaccination for kids over 12? And then what are the considerations parents need to make for kids under 12? What can they be doing? And then what's going on with clinical trials?
Right. So, you know, initially, not a lot of kids were getting tested, and it didn't seem like COVID was really affecting little kids as much. But I think it reached a high point like in March before we started doing vaccines for kids over 12, that maybe 22% of all new cases were kids under 18. So it's a huge number of kids that are getting and could potentially get COVID. Regarding the vaccines, let me start with the little kids first. So these are kids under age 12, not currently, there's no vaccine currently for them that's been approved, but both Pfizer and Moderna are doing trials now in kids. Pfizer's doing trials in kids 6 months to age 11. I'm currently one of the sub-investigators working with a local research group here at Bayview Research. And so we've enrolled kids age 5 to 11. So they were all enrolled in the beginning of June, middle of June. So we're collecting data. And of course, we don't have any conclusions yet. They're going to be followed for at least 6 months. We may have, they may be able to request emergency use authorization for that vaccine for that age group prior to the 6 months being over, depending on how, you know, successful it looks at that point and how safe. So far, just anecdotally, I could tell you from my experience in seeing them, it's extremely safe. We've only seen, you know, a handful of kids with like fever, their arm hurts, kind of very common vaccine associated side effects. So that's very, very encouraging. It is a smaller dose. So adolescents from age 12 to 15, and then all of us as adults who are getting the Pfizer vaccine, that's a 30 microgram each time that you go to get it. And the age 5 to 11 is going to be 10 micrograms. And then kids under 5 are going to be getting 3 micrograms. A lot of people ask, like, what if my 11-year-old is bigger than a 15-year-old, or vice versa, my 12-year-old is tinier than a typical 10-year-old? Is that a problem? The vaccines are not given according to how much you weigh or how big of a person you are. So vaccines have to do with the maturity of your immune system. So if you're 12, then your immune system is mature to a certain point, regardless of whether you're a 150-pound 12-year-old or an 80-pound 12-year-old. So I think that's been a pretty common question too. So, you know, we can't really comment on the CEO of Pfizer has made a statement that perhaps the vaccine for kids under 12 may be available by the fall, September, but so far, you know, we're still waiting on the data. So we won't really know just yet.
Dr. Peng, I just want to ask a follow-up, and this is to Chris's question earlier. So we did answer the question about soonest availability of vaccinations for youth under 12, but what are the thoughts and concerns about them returning to school without vaccines being available yet? So we do have schools opening back up as early as next month. Yeah. And what if vaccines are just not available at that time?
Yeah, I mean, I believe that, you know, parents are going to have to look at their individual situations of their schools. At this point, the wearing a mask does definitely decrease the transmission. If you have a child who may be at higher risk due to any pre-existing conditions or anything, I do think that makes sense to, you know, contact your pediatrician now and have a conversation about how that's going to be, because we had we fielded a whole bunch of questions when kids started going back to school with the hybrid program towards the end of the last school year. And so I think schools and parents had a chance to kind of taste that and see how it was going to be. But now it's going to be everyone's going back to school. So it might be a good time to have a conversation. But I do think that it is, you know, you have to balance it with how important it is for kids to go to school too. Certainly kids in that age group, though, that are in the middle school, and if they can get vaccinated and they're 12 and over, I do want to emphasize how important that is.
Great. And I just want to keep moving through our discussion. Will folks need booster shots? Will folks need booster shots? And then I also want to ask a question about the Johnson & Johnson shot. I've been seeing some things in the news about potentially guidance around having the Johnson & Johnson shot, and then you might be able to get a booster of a Pfizer or Moderna. So what is the authoritative voice on this? Is there one? Booster shots and then a booster shot with Johnson & Johnson in particular?
I'm not sure if Dr. Clark wants to take that, or if you want me to start?
Yes,
I can start just by saying.
Yes. So let's go with Dr. Gonzalez and Dr. Clark.
So far the CDC and, you know, there has not been any recommendation that boosters are going to be required, at least not at this time. As new infection rates across the country and across the world change, as new variants get imported or homegrown, you know, we will have to reassess and see if the current vaccines are still going to be protective. And if not, then at that point, I would imagine that there may be a need for a vaccine booster. But at this time, there's no official recommendation for boosters for any of the 3 vaccines.
Yeah, that's about all I would say too. Some of the vaccine companies are planning clinical trials looking at new formulations of their vaccine or booster shots, but those are still to be studied. There's no data yet as to whether a booster would be helpful or not.
What about insight for any of those who are immunocompromised in our community and booster shots?
Still no data on that either. People who are immunocompromised, even if they've been vaccinated, do seem to be more vulnerable to COVID. So that is a concern, especially those people. I would take certainly all the recommended precautions in terms of masking, social distancing. But yeah, if you're significantly immunocompromised, and I'm not talking about people who are HIV positive and on meds with an undetectable viral load. I'm talking about people with like serious immunocompromise from immunosuppressant medications or something. Take extra precautions, but we don't know yet if a booster vaccine would be helpful with those people or not.
And what about the Johnson & Johnson vaccine? It was pulled for some time. It's back out. You can get the vaccine again. What about those who may have some concerns around the Johnson & Johnson vaccine and its safety?
Well, so we have systems in place at the federal level to track the utilization of all vaccines for any negative side effects that they may have. So those systems are thank God we have them. I mean, they have caught a couple of things that have caused the federal government to say, okay, well, let's look into this a little bit more and see if there's anything to this that would have us pull this medication, or in this case, vaccine, back. I mean, but it happens for all medications, not just for these vaccines. So that monitoring system is there to protect us. And so far, all of the follow-up research that has been done on all of the various, I guess, blips that were looked into for, the different vaccines, primarily Johnson & Johnson, haven't really sussed out any significant enough association with a negative outcome resulting from that vaccination to cause us to pull back on or revoking the authorization for the vaccine's use. So at this time, all 3 vaccines are considered safe and effective. But that's why, the monitoring system in the future will continue into the future to monitor. And if at some point there is a reason for a concern for health side effects from the vaccines, then whatever vaccine that happened to be shown to be associated with would then be recommended to be pulled back. But at this time, none are pulled back.
And I just want to add to that too. A lot of people ask about questions about side effects from the vaccines, and people say, well, you don't know. What if something happens 5-10 years down the line? What if I have one of these rare side effects? And it's true. You can't guarantee that there are no potentially rare side effects that are going to happen to you. But you're looking at the alternative, which is to become infected with a respiratory virus, where you have a 1 in 100% chance, 1 in 100 chance of death. I mean, the odds are not comparable. The minuscule chance that you might have a bad side effect from a vaccine is nothing compared to the very real chance that you will get sick, be hospitalized, and die if you're infected with COVID. So,
I just want to add really quickly about that question. When people say, well, we don't know, the vaccine's only been around for this period of time. Like, what if something down the line does happen? I think it's not only just saying that, well, that's very unlikely, but I think we have really good evidence that shows it's extremely unlikely. Because of the technology of the way vaccines are made, the actual protein that goes into your body, it literally disappears. It doesn't last for a long time. It's teaching your body to recognize that spike protein so that it can kill off COVID if you run into it. But the actual part of the vaccine that's already done, it's teaching and done its lesson to your body, is literally gone. So, and I think that's borne out by the fact that the technology of how the mRNA vaccine is made, it is unique. Of course, drug companies like to say, like, it's so awesome, we invented this new thing, but it actually is on top of a ladder and a ladder and a ladder of many, many years of similar vaccine technology. And all vaccines, even if they do have some sort of serious side effect that we discovered and it was a problem, it always occurs like very soon after you get the vaccine. So these are things that happen within days, a few weeks of the vaccine. And we've had plenty of time now. I mean, we've had millions and millions of doses that people have given, even after the research, to know that that's not happening. And so basically my take home is just to say that, vaccines, the way they work, they just don't cause side effects years later. They don't really have the ability to do that.
Thank you for that. And you answered, I was going to ask you a follow-up, Dr. Peng, but you answered it as you were answering that previous question. So thank you for that. I just want to jump to some of our other questions from all of our chats. How concerned should we be for increase in other vaccine preventable diseases due to decrease of routine vaccinations during COVID? So how concerned should we be about the decrease of routine vaccinations during COVID and other preventable diseases?
At the beginning of the pandemic, when we weren't really sure about all of the side effects or symptoms of the actual COVID infection, we as a public health department did recommend that vaccinations for COVID happen at least 2 weeks before or after other vaccines. However, I'd say it's been at least a couple of months now where we've said, you know what, we understand enough about what COVID looks like to be able to say, go ahead and have it with your regular vaccines. You don't have to have that 2-week buffer before or after. So it's okay to get your regular, vaccines, your childhood vaccines administered during your routine pediatric checkups, and get the vaccines that you need in addition to COVID at that time. You don't have to make a whole separate visit just to get the COVID vaccine. So I defer to my colleagues for more details if they'd like to add.
I do think this is a really important question, just speaking to disparities in health access on the whole anyway, because not only are smaller pediatrician offices and smaller family medicine offices in underserved areas probably didn't have as much PPE, probably didn't have as much ability to spread out and have social distancing. And so it was harder for them to staff their offices. And so maybe, a lot of patients missed out on going for their regular checkups, in addition to just people having fear about going to the doctor. So, unfortunately, health disparity in our communities, it just gets weasels its way into every aspect of our health. So we really need to be aware of that too, that if you are able to go back to your pediatrician, get caught up on your shots, by all means do so. But, we have to understand that it's not as easy for people to do that as we would like to think.
As we wrap up, go ahead.
I wanted to just add
Go ahead,
one last comment. Sorry, just one last thing. I think also for LA County, for all of us that really care, and everybody that would come to something like this on a Friday afternoon, you care. So I'm just going to claim you in my tribe. But I think that we have to be realistic about how do we do some of our own self-awareness, because LA County has a history of pockets of disease. As you talk about the social determinants and the persistent disparities, we've lived with that since back as far HIV/AIDS. This takes us back to the early 90s, the STD epidemics, which continue to aggravate certain small concentrated pockets of zip codes and geographical space. This is where we have to do something different. So these effective saving lives through effective community partnerships, we don't partner well with the grassroots influencers, the community influencers. We partner with gigantic corporate nonprofit institutions. We don't, and so I think that's just something to remember as we dig down for our audience and my colleagues here, that we just need to continue to try to find ways to deepen these partnerships so that we can really turn our system around and try to save lives. That's what it's really about. Every day, that's what we get up for, is to save lives. So thank you all so much, Dr. Usku.
Yes. Thank you, Ms. Branch. And as we're wrapping up, Dami, I want to ask a couple more questions, but as we're wrapping up and before we ask our final questions and closing thoughts, I do want to ask you to get our raffle winners ready. So let's all get our raffle. Let's get ready in case we win that raffle, to click in the chat and let folks know that we are indeed here. All right, so what qualitative data can we use to pinpoint general ambivalence towards vaccination?
That's a good one. The death rates. I recently lost someone very close to me this week, Monday, July 19th. Totally unexpected, a very healthy person, almost vegan in their eating habits and their diet. They lived in one of the right zip codes. We got a zip code list to decide what your health position is. So we kind of cheat and look at it from time to time. And he was in all those high indicators. He was out unvaccinated, what Dr. Clark talked about, just resistant. And we've had these talks in our offices, so I'm just be transparent. I won't give any names. And people just have their opinions. We just had a talk with Charles Drew University, one of their executives, and in their enrollment process, at least 20% of students don't want to take the vaccine. This is a health academic research university. Really, so that goes to show how much work we have to do as public health workers, health service workers, community workers, researchers, to really, somewhere we're not doing a good job. I just have to say it to myself, that with all the funds and what we're doing, we're still missing it somewhere. And I don't know where that is. It's something in our collaboration and connection. We're not messaging, we're ignoring something. So I think, Delara, in the theory of change, we just have to stay at it. We have to keep these messages out there. We have to keep it in their face. We have to work through our bureaucracies to try new things. We should be on every platform. And if we looked honestly and did an honest assessment in our three-legged stool, which is DPH, DHS, and mental health, we're not doing everything that we possibly could. Right? And it's not because of a lack of will, it's the bureaucracy. So we have to release some of us into those roles to go way up the hill and talk to the people at the top. How do we stop some of this? And while the rest of us are throwing life rafts at people literally drowning in the water, and we just have to keep increasing that type of synergy. We're just not there yet. So that's what I would say. We're not there yet. We need to stay vigilant. We need to bring in new leadership. We need new young people operating all over the county to take on these influencer roles. We have to invite them to the table. If we want to reach 12 to 16, we need 12 to 16-year-olds sitting with us, and so forth and so on. And so however we can be a help, that's why I'm volunteer to Dr. Uscoop, Dr. O, Dr. Gonzalez, Dr. Pang, Dr. Clark. We will be here to help bridge you to those important communities, and then we can get out the way. We're like AAA. We just want to connect you. Do you need a tow truck? Are you going to need a lock change? Do you need some gas? That's all that we want to do, is be that bridge to help people get to the resources. We're overwhelmed with the death. Like I said, I just lost someone in our own circle. And it caused at least 3 people in our organization who were also vaccine hesitant to at least go get tested. We said, if you're not ready yet, because if you're not ready to save your family, know your status. And that would be the first step of having some critical thinking about how you handle this disease. If you absolutely decide I'm done with it, I am the conspiracy theorist, I don't trust government, I don't trust public health, then work with us through our financial literacy program so we can make sure you have a transition plan. We don't want to take care of your children. I have another family, a couple, 3 children. Both parents got COVID. Both parents are down. The children are running through the house. That's how we got the call. And someone accidentally fell. And so we find out these kids have been in this apartment with their wonderful parents, 2 hardworking, but neither one of them could care for them. And they were shamed. They didn't want to let us know, we're caseworkers, that somehow they didn't do this, and look what has happened. So we said, are you ready to get that insurance policy now? Are you ready for that long-term care plan? Do you want to talk about the difficult things that your decision or lack of decision is going to leave your family? So this, again, I say it's about the one-to-one. It's about breaking it down to micro and mini contacts and staying the course and getting people one-to-one to take those kind of very important steps. The science is important for our leadership. So we need Dr. Gonzalez, Dr. O, Dr. Pang to talk to county leadership, but we need you all to be there with us so we can talk to everyday people and help them understand how to use the data. Why is it important? Where does it come from? What supports the data? How do you push back a little, but still have some critical thinking and plan for your future? If you're empowered, nobody wants to take care of your kids. Nobody wants to do that. We're all stretched and then stretch it a little bit more, and households are just going to fall apart, folks. So we've got to think about these things. It's about your loved ones. It's about your neighbors. It's about the people you care about. We have to do everything we can. Our best talent, our A students, we need you to step up, sit at the table with us, and show us how to get this right.
As we close, I want to end with two questions, and I want to just extend to just two of our providers, or Ms. Branch to or Dr. Gonzalez to answer. And one is, how can we incentivize folks to get vaccinated, whether that's giving gift card, Target gift cards, $5 Walmart gift cards. Is that something folks can do? What should they do to incentivize other folks in getting vaccinated? And then the last question I would like to answer is, it seems that many vaccinated, including myself, and this is a question that we received, personally know at least one person that does not want to get vaccinated. One of those individuals works in public transit and told me that they would only get vaccinated if their employer required it for work. How can we start getting public employers and agencies to require it? So maybe this is a question for you, Dr. Gonzalez. In the future, do we know if vaccines are going to be required to use to access homeless shelters? So what can we do to encourage folks to get vaccinated? And yes, what can we do to get folks to encourage folks to get vaccinated? And then what can we do to encourage our employers to encourage their employees to get vaccinated?
Great questions, first of all. I think following up on what Cheryl was saying, I think it's very important for individuals to share their story. If you've been vaccinated, tell your family, tell your friends, tell your coworkers why you got vaccinated. What how did it go for you? Did you get side effects for a day? Were you down for a day or two? Or did you get I think having actual personal stories from people you actually know, but not just these talking heads on a screen, goes a long way towards having people be more willing to at least consider it. So that's, I think, one of the things that can happen, in addition to having influencers, is having actually personally someone in your personal sphere actually tell you why they got vaccinated and what their experience was. Additionally, we in LA County and the state are issuing gift cards and having raffles, et cetera. So all that information about what is the most, it seems like one promotion, if you will, goes away, another one comes right up behind it. So they're always available on our, there's two web pages that we have. One's in English and then the same information in Spanish. In English, it's vaccinatelacounty.com, not .gov.com. And then in Spanish, it's vacunatelosangeles.com. And on there, you can find the information about what's the most current promotion. There are promotions that apply not only to the people being vaccinated, but if you are an individual that encouraged someone else, you brought someone with you to get, like, for example, you're coming in for your second shot and you're bringing, your neighbor or your cousin to get their first shot, you are eligible for bringing them in for their first shot as well. Even perhaps you've already gotten your own raffle, if you will. So it's in terms of getting people encouraged to consider vaccination, those are some of the things that I would consider. As far as requiring vaccination for employment at this time, so there's a difference between vaccine authorization and vaccine approval. So vaccine authorization is where all the three approved or authorized vaccines fall into that category. That means that we are in a state of emergency and there are no other viable options for treatment. And in order to prevent, massive casualties, we've researched this medication, this vaccine, whatever it is, enough to say it's safe enough, it appears effective, it appears safe. Therefore, we are going to allow its use. So authorized means we are allowing its use because we are in the state of emergency. So it's an emergency use authorization or an EUA. That's different from saying it's an approved vaccine. Now, generally, to be approved, vaccines and any other kind of like medication generally go through years and years of studies and on different populations, on different age groups and different ethnicities, et cetera. And once there is enough convincing data that says that there are no serious consequences that would prevent us from wanting to move forward with this medication or vaccine, then the federal government says, okay, then we are approving this. So most vaccines, all the childhood vaccines, they are approved. So the COVID vaccines are the only ones right now that are currently under emergency use or authorization. So legally, unless a vaccine is approved, which none of the three currently are, they cannot legally be required. So you can't require it for school entry. You can't require it legally for, employment, for example. There are a lot of ethical experts who are debating, the potential of requiring it at least for healthcare professionals who are going to be, in clinical settings with patients. And if the clinical professional themselves does not want to get vaccinated, then maybe they would not be able to continue their practice because they could potentially expose many, many probably vulnerable people because they're going to them for healthcare services because there's something, physically, medically, potentially wrong. So as far as other, non-healthcare setting types of employees, it's really up in the air. And again, none of them are likely to be required by any employer until they are actually approved. And I believe Pfizer is on some sort of track to they've requested approval, I think, don't quote me. But eventually all the providers are going to want to get approval, but that's a much longer process. And so far, none of the 3 vaccine manufacturers have obtained that.
Thank you for that, Dr. Gonzalez. And I do want to bring up our closing slides. We have been getting some other questions, including, debunking misinformation on a micro level. And what we have done is include a lot of information in the chat. I just want to put out the Kaiser Family Foundation. They have a whole thing around the conversation. It's available in English and Spanish. And a lot of that kind of misinformation, they talk through, using subject matter experts and providers. They talk through all of those sound bites that, that are out there and address them directly. So I do want to point folks to that. I think it's so helpful. They made it tweetable, shareable, downloadable, all of that. So I just want to share that. And then we have other information around how the community can get access to information in the county around COVID-19 and the vaccines. And that's available in our chat. And also we will have a follow-up email with all the links that have been provided in this chat and other resources that we're aggregating on our CBAM website. So we will continue to share that information out. And without further ado, if we can turn to our last couple slides in our slide deck as we wrap up. Ms. Branch, do we have our raffle winners ready?
Yes, we do. We have the names in the raffle. So let me get that ready. I will. Do you want me to kind of just run through the list right quick? Because I believe.
Let's run through it quickly. Yes.
Okay, because some people signed off, but I think I have everyone here. So if I missed your name.
We want to thank everyone for attending. I want to thank Enrique. I want to thank Dami. I want to thank our Fab 5 panelists, including Dr. O. She had to get to her. She's on the go. Dr. O is on the go, but I want to thank her also. I want to thank everyone that joined us today, everyone in the community, all our community members, all of our partners. Our video will be posted on the website, and an evaluation will be emailed to all those who are registered. I do want to put in a shameless plug. We have some focus groups where you can get another gift card. Enrique, Dami, we can just post that. If we can share the flyers for our upcoming focus group that's coming up next week to learn a little bit more about your thoughts around COVID-19. It's a community focus group on Monday, July 26th. Please email Dami about that. I also want to shamelessly plug for my Cannabis for Pain Management research study. If you are a Black American who is using cannabis and you have chronic pain management, please contact me. I need to hear from you. You can get a gift card. So we want to hear from you. Shameless plug, shameless plug. And then also we want to let all the providers on the line know we're going to have a provider community summit August 20th for providers. Let all your providers know about best practices and lesson learned around COVID-19 and the effort to improve vaccination access and equity. And then we're also going to do this exact thing again, this community summit, but we're going to do it in Espanol. We're going to do it in Spanish for all of our Spanish brothers and sisters and persons and friends and loved ones here in LA. And that will be coming up soon. It's going to be another fabulous panel. We want to thank everyone for joining us. If you won as a part of that raffle, please send us your email address so we can be in touch with you. Again, please send out the post evaluation chat, and a million thanks to Enrique, and 1,000,001 thanks to Dami, and 1,000,001 thanks to all those who joined in. We had over 105 people present. Thank you, thank you, thank you. Have a great weekend, everyone, and please, please stay safe and take care of your families. All of our best. Thank you.
Thank you. Bye-bye.